Hi, and welcome to Chapter 5. And I want to just go ahead and throw it out there that this chapter may be a bit long, but there's a lot of good information contained here. And I will be mixing some videos along with lecture to make up this chapter. So, first of all, this is pretty much the introduction part. And what we're talking about here when we talk about anatomy, we're referring to the structure and components of the human body. In pathophysiology, this is the study of the body functions in an abnormal state, and physiology examines body functions. A lot of people think A&P or anatomy and physiology are the same thing, but they're not. And pathophysiology is different as well. So, and just a few things for terms here. Gross anatomy, that's what you see. And microscopic anatomy, something you have to look at through a microscope. So, topographic anatomy, this refers to our landmarks. Our body is made up of landmarks all over, and we'll talk about a few things as we go. And the anatomic position, and I'm just going to go ahead and go to the next slide and show you right quick, is right here. This lady is in the anatomic position. I'm going to try to blow it up a little bit so you can see it a little better. And that is the anatomic position there. So, if you can see, the palms are up, as well, and the patient would be facing you. Now, whenever you use directional terms like left and right, those terms belong to the patient. So here, left and right refer to the patient's left and right, not your left and right. Now I want to talk about some planes of the body, because the body is divided in planes, and I think it might be best if I just blow this slide up again. That way you can maybe see it. Wrong direction there. Alright, so here we have the sagittal plane. If you can see, it goes all the way up through the middle of the body, dividing the body in half. Then you have a transverse plane that goes through the middle of the body this way at the umbilicus, dividing the upper and lower halves. So the sagittal plane divides the left and right halves. The transverse plane does the upper and the upper and lower. And the frontal plane, or the corneal, divides the front from the back. So it goes through the shoulders all the way down, and it does, your anterior and posterior. So here we have some directional terms, and we need to know directional terms so that we can discuss, or we know what people are talking about when it comes to where things are. And I'm going to try to blow this up again. I may have did it a little too much. There we go. Alright, so we have medial, which is the midline. Anything towards the midline is medial, and anything away from the midline is lateral. Remember, we always use the patient's right and the patient's left. Posterior means rear. Anterior means front. Superior is anything towards the head. Proximal is anything towards the body. Distal is away from the body. And inferior is away from the head. So the superior in a vena cava comes from the head, and the inferior comes from below. So some directional terms, we have right and left. We have superior and inferior. We have lateral and medial, which means laterals to the side, medial towards the middle. Proximal and distal, superficial and deep. So superficial would be used to describe a wound, like he has a superficial wound, which would be one that is not very deep. And anterior or posterior, which is anterior is the back side, and the front side. I'm sorry, I got that backwards, didn't I? The anterior is the front side, and the posterior is the back side. So movement. So range of motion means that you're able to move a joint in its full distance. Flexion brings the distal point of an extremity towards the trunk, whereas extension returns that part to the anatomic position, which would be away from the trunk. Abduction moves an extremity away from the midline, like you're abducting something, you're taking it away, so away from the midline. And adduction moves the extremity towards the midline. Hyperflexion, this is whenever you flex something to or beyond the normal range of motion. And hyperextension, something we hear about when we listen to sports a lot. This is something where when you extend something beyond the normal range of motion. Supination, this is turning toward the palms upward, and pronation turns the palms downward. Internal rotation, this is when you're turning an extremity towards the midline, and an external rotation is when you're turning it away from the midline. So if you had an externally rotated foot, that could be a sign of a hip dislocation. All right, some other directional terms. We have bilateral, which means both sides. Unilateral, which means only one side. And the abdomen is divided into the right upper quadrant, which would be RUQ. Left upper quadrant, LUQ. The right lower quadrant, which is RLQ. And the left lower quadrant, which is LLQ. So it's good. We need to know this. So like if you have a bilateral femur fractures, I know you've got both femurs are fractured. If you're having pain in the right lower quadrant, then I can think where that is. So some anatomic positions. We have prone, which is if someone's prone, they're laying face down. And supine, you're laying face up. Trendelenburg, this is supine, so you're laying on your back with the feet higher than the head. The shock position, this is the head and torso are supine with the lower extremities elevated. Fowler's position is sitting up with the knees slightly bent. In the recovery position, you're laying on your side, bottom arm extended straight with the head laying on it. The top knees bent, angling body slightly towards the floor. So we'd have to see that to really know, and we will work on it in lab. Well, that's it for the introduction part. And we'll be getting into the next sections here shortly. Please just make sure you follow everything in order on the sheet, because this one is going to be we're going to have videos mixed in with lectures. So, thank you.